Why hip mobility matters.
The healthy hip mobility is crucial for comfortable movement in daily life and exercise. Tight hips can lead to stiffness, lower back pain, and reduced athletic performance. Addressing hip mobility supports balance, posture, and flexibility, helping to prevent injuries whether you're sitting at a desk or staying active.
Common causes of tight hips.
Sitting for long periods is a major reason hips become tight. Lack of stretching, repetitive movements, and not moving through full ranges of motion can also lead to stiffness. Over time, this can impact how you walk, lift, and even how comfortable you feel doing everyday activities.
Gentle hip mobility exercises.
Legs, seated knee lifts, and gentle leg swings. Lying on your back and pulling one knee to your chest stretches the hip flexors. Figure 4 stretches, where you cross one ankle over the opposite knee, can help open up the hips safely.
Dynamic warm-ups for hips.
Dynamic stretches prepare your hips for activity. Try walking lunges, deep squats with support, and side-to-side step-outs. These moves gradually increase mobility by encouraging the hips to move in different directions, helping improve strength and flexibility with consistent practice.
Tips for safe and consistent practice.
Focus on good form, rather than depth or intensity. Move slowly and breathe steadily. Aim to include hip mobility exercises in your routine 3 to 5 times per week. If you experience pain rather than gentle stretching, ease back or consult a professional for guidance.
Benefits of improved hip mobility.
Regular hip mobility work can ease tightness, enhance functional movement, and support better posture. Over time, you may notice increased comfort during activities such as walking, running, or sitting. Committing to these basic routines helps maintain hip health and supports active living at any age.